All right, so there's a couple of webinar logistics. There we go. Webinar logistics. So you are muted throughout the presentation, so welcome. You do still have a voice, however. You can provide questions using the chat box or the question and answer function within your control panel. Either way that you submit questions or comments, we will receive them. So for the duration of the webinar, we're going to mostly hold questions for the end. If there's a question that comes in that is specifically clarifying information or we need to answer it in order to help people move forward, we'll absolutely tackle that question then. But for the most part, we're going to save them toward the end. That doesn't mean you can't submit questions throughout. We actually encourage that you do so. This webinar is in fact being recorded and it is being captioned. And so that is both of those sets of materials. It's all going to go out after our captioning process is completed and our recording process is completed. So if you haven't joined us live today, welcome. For those of you who have joined us live today, we're going to give you a chance to practice using your chat box. So if you could take just a second, locate your chat, select in the to spot the all panelists and attendees, and type in where you're located and what the weather's like. We're going to pause for just a second so you won't hear sound for a minute as people type in where you're located and what the weather's like. We're here in St. Paul, Minnesota, and the weather is a little bit gray and rainy. Oh, wow. You've all found it quickly. So I see a lot of Minnesotas. I see Virginia, see Philadelphia, see South Dakota, Virginia again, Kansas, that's exciting, Pennsylvania, New York. Wow, we are from all over. Oklahoma, more Minnesota, more South Dakota, North Dakota, Nebraska, represent, Arizona, Maine, more Minnesota. Wow, y'all, it also looks like it's a little bit rainy for a lot of us. So, or just cloudy, rainy and cloudy. So for those of us who are in the rainy and cloudy, super bummer. Like I'm a person who I would prefer, even if it's cold, to sunshine. Maybe you're that person too. For those of you who are enjoying beautiful weather, I am envious and I wish I were with you. So thank you for practicing your chat box throughout the presentation. Again, this is how you can send us messages. It's how you can ask questions or throw in your 2 cents if you have a really great idea or concept you want to push out to the group. Please feel free to do so. You can also use your question and answer function. Feel free to do that as well. So, to our rural webinar. This is the last one for the year, and I am 100% thrilled to hand it over to my really brilliant and super clever colleague, Sarah Florman. Nope. I went too far, friends. All right, now all you, Sarah.
All right. Hi, I'm Sarah Florman, and I'm the Trafficking Policy Coordinator here at the Minnesota Coalition Against Sexual Assault. And today I'm going to talk to you about sexual exploitation and trafficking, specifically in rural settings. So the first thing I want to know is, does your state have a safe harbor law? You may or may not know the answer to this question. As of April 2017, 32 states have laws providing immunity and or diversion programs for youth engaging in prostitution. And 24 states have some kind of collaborative, coordinated response to sex trafficking. So if you don't know if your state has a safe harbor law, look it up, find out, and if you don't have one, this is something to call your legislators about, especially starting Wednesday morning, I think, is a good idea. All right. So to start off, what are sexual exploitation and sex trafficking? The first thing I want to point out is that there are various terms that people use when they're talking about these issues. You might hear people talking about SVJI, which is sexually exploited youth. You might hear DMST, which is domestic minor sex trafficking, or CSEC, which is the commercial sexual exploitation of children. All of these basically mean the same thing. The definition of sexual exploitation basically is that when anything of value or the promise of anything of value is given to a person under the age of 18 by any means in exchange for any type of sexual activity. A third party may or may not be involved. And when we're talking about things of value, that could be money, drugs, food and shelter, could be rent, it could be status in a gang or social group. Sex trafficking is the recruitment, harboring, transportation, provision, obtaining, patronizing, or soliciting of a person for the purposes of a commercial sex act in which the commercial sex act is induced by force, fraud, or coercion, or in which the person induced to perform such an act has not attained 18 years of age. To break it down, trafficking is exploitation that involves a third-party facilitator as well as forced fraud and coercion. That's the federal law. States may have different definitions of exploitation and trafficking, so look into those specific to your communities. All right, so this diagram kind of shows you a broad picture of sexual exploitation in its larger sense, which can include things like sexual abuse and assault, survival sex, pornography. Commercial sexual exploitation is when there is an exchange of money and when there is a third-party facilitator. All right. Safe harbor laws provide two basic things. First, they provide legal protection. So that is either immunity from prosecution for certain types of offenses, or it can be diversion programs that require participation in services for dismissal of charges. And different states have different ideas of what those legal protections should be. The second piece of safe harbor laws is the provision of services. And those are services to the victim of the trafficking or exploitation. It includes things like housing and shelter, medical and mental health services, education assistance, job training, and legal services, among others. How does sex trafficking happen? So there are a variety of different situations and contexts that this might occur in, but the general framework remains the same. Overall, there is a process of recruitment, followed by an initiation and breaking period, followed by the implementation of barriers to escape or methods of control that are used by the trafficker. Some common methods of recruitment include relationships with someone involved in prostitution. This could either be a familial relationship or a romantic relationship. Typically, when we're talking about sex trafficking, it tends to look like the individuals, they call them their boyfriend, they call them their daddy. The word pimp is what we're talking about, but that word is not what's generally used by the actual victim. Exchange of sex for basic needs is really a common entry point, especially for youth who are runaways or homeless. If they need a place to stay or some food, they will often exchange sex to get those things. Coercion using drugs and alcohol, very common. Other methods include being lured through promises of work or benefits. Youth may start working as dancers in strip clubs, and then the process kind of intensifies. Advertisements for modeling work are another really common recruitment method that happens particularly on the internet. And then social media. And when we're talking about social media, we're not talking about Backpage or Craigslist. We're talking about Facebook, and we're talking about Snapchat, and we're talking about games with chat functions. All of these places are known for youth participation, and so they're very common places for traffickers to look. The next phase is the initiation and breaking period, and that usually involves isolation from friends and family. This might include things like your family doesn't love you as much as I do. I want to know who you're talking to. I'm going to keep your phone. Both physical and emotional isolation. It can include things like rape or gang rape. Sexual, physical, and emotional abuse or torture are very possible. Inducing or enabling a chemical addiction is a really common method to initiate and break youth into trafficking. Pornography and blackmail is another one that's very common. You will find that youth might send sexually explicit photographs and then get told, I'm going to share these with your family and with everyone you know if you don't do what I ask you to do. Exploiting feelings of worthlessness, calling these youth damaged goods, threat of criminal prosecution or deportation, exploiting the trauma bond, which means if you love me, you'll do this. No one will ever love me as much as I do. The youth might be given a new name or identity. Tattoos or branding are sometimes used to help traffickers kind of identify their products, if you will. And then we go into methods of control. So the control process involves the continued use of breaking techniques, the ongoing actual or threat of abuse and torture. Often they might make an example out of another victim. They might withhold your money or your identity documents, which could include things like your visa or your driver's license or your social security card. You might not be able to leave because without those papers, you can't get gainful employment. You can't prove who you are. You can't rent an apartment. You are fully dependent on the trafficker. Other methods of control include threats to families or children. They might cause and exploit a pregnancy. And a very common one is the pressure and guilt by playing the friendship or boyfriend card. Again, it's that if you really love me, I love you like no one else will. I need you to help me out. Maybe it's, I can't pay the rent unless you help me do this. That type of pressure is really common. Who are the buyers? So research shows that typically buyers of sex are white married men. They tend to be middle and upper socioeconomic backgrounds. These individuals are often respected and influential members of society. They have power and privilege and they use it. Another thing to know is that most buyers do not purchase sex right where they live. Typically, the buyers will travel an average of 30 to 60 miles. And that means that guys may buy sex, maybe they work in the city, they may buy sex and then drive home to the suburbs. They may go on a business trip and buy sex while traveling. Hunting trips are a really, really common situation. Yeah. So what I'm saying with this is that the buyers are living in the suburbs and the victims may or may not be living in the suburbs, but they're generally not living nearby. So these buyers could be anybody. All right, the next piece I really want. Okay, the next piece I really want to focus on is myths versus realities. We've got media and film that's creating misconceptions of all aspects of trafficking. Things such as the movie Taken is a really good example of what trafficking doesn't usually look like. And that's not to say that instances like this don't occur, but typically trafficking is a much more subtle, insidious, and close to home operation. Sometimes these myths can be perpetuated by really well-meaning folks or organizations that are looking to draw awareness to the issue. So one of the things that we battle when we're working with sexual exploitation and trafficking is the false narratives that can be created. If you were to type sex trafficking into your web browser, these are some of the images that may pop up. There are two typical archetypes. You'll see the street prostitute and you'll see the helpless, innocent child. When you're talking about sex trafficking of youth, primarily what you'll see is that child. Very young, typically white. There will be indications of physical restraint, such as handcuffs, rope, tape, etc. What I want to make really clear today is all of this is wrong. This framing is absolutely wrong, and it can be very harmful to the movement. If we say this is what trafficking is, then this is what people will expect to see, and the response will, of course, be moving forward on its own. The response will, of course, be, that doesn't happen here. So the unintended consequences of some of this imagery is that there is an assumption that exploitation has to include force, fraud, or coercion, that it will be obvious, and that victims are innocent-looking, white girls and women wanting to be rescued. When we're talking about who's actually at risk, the reality is that the highest percentage of victims of exploitation and trafficking of youth are girls of color from poor communities. But young people of all demographics are potentially at risk. This includes boys, girls, all races, and socioeconomic statuses. Trafficking is often invisible, and the youth themselves don't always realize what's happening to them. They don't necessarily see that they are victims or that they're being trafficked. They consider themselves to be very independent. Maybe they are in love with their trafficker. A huge piece of the problem when working with these individuals and talking about these individuals is that the word victim is not embraced by them. No one wants to be a victim, and these young people in particular. Some of the risk factors that can lead a youth into a situation where they're exploited or trafficked include poverty, homelessness, history of sexual or physical abuse, lack of resources or support systems, parent or guardian or family member addiction to chemicals, a history of out-of-home placement or foster care, school dropout, chemical dependency, mental health issues, lack of support systems, so lack of extended family members or friend groups or school social workers, emotional distress, so life-altering events, family divorces, deaths, any sort of situation that may occur. Simply being a teenager is sometimes emotionally distressing, and that's something that we don't emphasize enough. Other risk factors include oppressed populations. These folks are often more vulnerable, minorities, LGBTQ youth, etc. Because vulnerabilities are what the traffickers are exploiting, any vulnerability is really a risk factor. Family member involvement in prostitution and trafficking and exploitation can be a huge piece, partly because it becomes part of the family culture, it may be normalized, and it may be something that family members expect. Gang involvement can be a risk factor. Lack of support systems and immigration status. Folks who are not documented may be especially at risk because if they have papers, those papers might be being held by those traffickers with threats of deportation hanging over their heads. Where does trafficking happen? The short answer is everywhere. It's not just happening at street level. It's occurring in nearly all communities, and this is particularly because of the internet. Online ads are available to anyone with an internet connection, a smartphone, a computer, a tablet, you name it. It's happening at truck stops. It's happening in massage parlors. It's happening in hotels and motels, even in suburban areas. Increasing awareness in the community can improve intervention and prevention by teaching people what to look for and how to respond. So, what can we do? There's a few things. We can learn what to look for, we can engage in prevention efforts, and we can respond with services and support. So the first thing is to start recognizing the signs. When you are engaging with a young person and you start to see certain particular signs, it may potentially raise a red flag in your mind that this person could be involved in exploitation or trafficking. Some of these signs are things like a pattern of running away, history of abuse. The youth may have money, a phone, or other items of value that can't be explained or accounted for. They may be posting sexually explicit materials online. They may have a relationship with either an older partner or they're unwilling to provide information about their partner. These are not all the possible signs, and these signs don't necessarily guarantee that a youth is being exploited or trafficked, but they are pretty common red flags. The combination of 2 or more of these is something that you should look into a little further. When we talk about prevention in terms of exploitation and trafficking, we want to address demand. If no one buys sex, the demand goes away. If society becomes a place where buying sex is no longer acceptable, the demand goes away. Safeguarding vulnerable populations, so providing education to young people, resources, support, making sure that young people are aware of what healthy relationships look like, making sure that young people are aware of the dangers of engaging with folks that they don't know. The third is to reduce the profit. So increase penalties for traffickers and buyers. Make this too expensive of a business venture to continue. Protocol development is kind of my favorite way to talk about the response to trafficking and exploitation in communities. When you're talking about developing protocols, what you're talking about is creating a system of rules that explain the correct procedures to be followed. In Minnesota, we have safe harbor legislation that includes the development of statewide protocol guidelines, and they are intended to assist communities in developing their response. So when we're talking about protocol development, the kind of main points to consider are community-specific response. Trafficking, exploitation manifests differently in different places, and communities can vary significantly in the availability and types of resources in terms of response. Multidisciplinary collaboration is really important. Victims will be engaging with various systems at different points, and we need those usually siloed systems to work together to improve the overall response for that victim. SARTs are an excellent way to start this process. These are multidisciplinary teams that already exist in many communities. Sexual exploitation and trafficking are forms of sexual violence. So these SARTs contain many of the key disciplines that are needed for an effective response to exploitation and trafficking.
So I have a really great question that just came in that feels as a more pressing one.
Okay.
So the person wrote, you often have noted, or so often as you noted, the buyers are often upstanding, powerful men in the community who are traveling to engage in trafficking. What are the odds they would support efforts to manage the demand for commercial sex?
That's an excellent question. One thing that I will say is that sexual exploitation and trafficking of youth is a bipartisan concern, and I have never met anyone who would publicly say that they don't support methods and efforts to reduce or eliminate those things. The quickest answer is they may not internally want to be preventing these things, but they tend to know better than to say so out loud. All right, so when we're talking about creating a protocol response for exploitation and trafficking, there are a lot of systems that could potentially be involved that are involved with young people. The key disciplines are the ones that I have listed here on the screen. Advocacy, which includes community-based and systems advocacy, including victim witness advocates in the prosecutor's department. Child protection and child welfare. A lot of these youth tend to be involved in TIPS cases. They are able to provide a connection to resources, case management, and they often have decision-making powers in placement if the youth needs to be placed out of home. Juvenile corrections and probation. A lot of the risk factors for youth involved in corrections are very similar to exploitation and trafficking. There's a lot of overlap. A lot of times there are criminal behaviors that may stem as a direct result of the youth being exploited or trafficked. And so it's a pretty valuable connection, including the fact that a lot of times corrections and probation officers are going to encounter these victims in those settings. A youth may come into a corrections facility and disclose having been sex trafficked. So these folks need to be able to be part of that community-wide response. When we're talking about health professionals, we're talking about frontline responders, SANE nurses, EMTs, ER doctors. We're also talking about public health and primary care physicians. We're talking about all aspects of healthcare. Law enforcement, both administrative and patrol levels. So this includes sheriff's departments, police departments, and state level law enforcement, as well as the FBI. Prosecution. A huge piece of the prosecution's job is to determine who the victim is. Is the crime that a young person is being charged with, is this exploitation related? This can look like a young person who was caught selling drugs. Perhaps they were required to sell drugs by their trafficker. Perhaps a young person has stolen some money. Perhaps that youth has stole the money in an attempt to get away from their trafficker. So prosecution has an important role in figuring out who the real victims are and what the cause of their situation is. They are also there to deal with the buyers and the traffickers to both lobby for heavier, what is the word I'm looking for? Punishments, I guess, fines, jail time, whatever, and also to help ensure that these buyers and traffickers are being held accountable. Schools, the involvement that schools have can vary a lot. Training for social workers and teachers in what to look for and how to help youth that do identify. Prevention efforts are really important in the school setting when we're talking about comprehensive sex education, including healthy relationships. We're talking about how to handle yourself online, how to interact with others, what to expect from your significant other. All of these things are really important. Schools are also a great place for identification. When we're talking about these youth, they're not often self-identifying, and folks in schools see kids for a really large portion of their day. They see them more often than parents do, more often than friends and family members do. So it's a really great place to be able to seek out and identify kids that may be involved in or at risk for exploitation and trafficking. When we're talking about developing protocols, there is kind of a process to it. The first thing you want to do is assess your status quo. What resources do we have available? What does our response look like as of right now? And how well are we doing? Are we serving victims, survivors, as well as we'd like to be? We're developing core messages, so creating guiding principles for how we want to respond to these young people in our community. Identifying the key elements of response primarily involves finding those key intersections between silos, the law enforcement advocacy connection, the child protection corrections connection, etc., and making sure that we are facilitating those intersections as smoothly as possible. The next step to developing a protocol is writing it. That's the most fun for everybody. So that process is where you figure out who's going to do the work, who's going to actually create this document. The final step is a review process. You're including survivors and cultural communities, other special communities that may be important in your community, and you're making sure that the protocols you've written work for them. So when I'm talking about all of this protocol development, I am talking about community-specific protocol development, and I'll get into that in just a moment. But when you're talking about creating protocols, you can't create something that will work for everyone. It's simply too complicated. Every area has different resources, every area has different systems and different types of responses. So in Minnesota, we've developed these protocol guidelines, and what they are are best practices that are intended to help communities develop region-specific protocols that work for them. These guidelines were created with the input of over 200 professionals and victim survivors, and they're grounded in 5 principles. Victim-centered means that the focus is on the victim's experience, the definition of success and justice. So for example, when we're talking about victim-centered, we mean that it's not focused on the perpetrator. It's not necessarily focused on prosecution. That may or may not be the victim's ultimate goal. It might not be what need they need to have met. Trauma-informed means that all interactions and services are grounded in an understanding of complex trauma. So all service providers are looking at youth in terms of what happened to you versus what did you do. A lot of times these youth have trauma that manifests in ways that we would often consider to be criminal. They might be aggressive, they might be angry, they might be using drugs and alcohol. These youth are not always seeking help. They often don't consider themselves victims, and a lot of their behaviors are survival skills and coping skills to deal with the trauma that they've encountered. Culturally responsive means a variety of things. It means race and ethnicity, geography, and socioeconomic status, meaning that you may have a youth from a rural area who is best served by folks in a rural area. You might have a youth who works best with service providers who look like them or have had experiences similar to their own. Culturally responsive can also include the LGBTQ community, youth culture in general, and then the culture of the life, the culture of exploitation and trafficking. Youth-centered means the neurobiology of brain development. We're talking about the actual physiological things that occur to a young person, the differences between young people and adults in terms of brain functioning, in terms of social awareness, etc. We're looking at the types of resources that are available to young people, the importance of social engagement and connection, and also some different rules surrounding data privacy. The 5th principle is strengths-based. Remember that these youth are resilient. They have survived through some things that a number of us could not ever imagine. We avoid framing young people as helpless victims. We avoid the word save and the word rescue, as young people don't feel that they need to be saved. A lot of times they don't want to be rescued. So some best practices and things to really remember are that young people really are victims of a crime. Young people who have been exploited are victims of a crime. And that's something that you would think would be at the top of everyone's mind, but it sometimes gets muddy. People who come into contact with youth should be trained to identify exploitation. Make sure that you are helping the victim to not feel further isolated or trapped. Exploitation and trafficking is trauma. Victim-centered services should be based in trauma-informed care. And services need to be responsive to the needs of youth. Ideally, when you're talking about response to exploitation and trafficking, you are looking at ultimately developing a statewide response system so that youth anywhere can be served, because the victims of trafficking and exploitation are in all communities. One other thing to really remember is that this can be prevented. All right, the piece that everybody's interested in. So in Minnesota, what we're doing right now is working with 5 teams across the state, developing community-specific protocols for their regions. 3 of those teams are located in rural areas. So we've begun the development process. It's definitely still a work in progress, but we've learned some lessons along the way. One of the things that we've learned is that just because there are not as many resources does not mean that a rural response can't be an excellent response. It's not about quantity, it's about quality. some of the other things we learned. In a lot of rural areas, we found that there's a big need for increased community awareness. So there are still a lot of people who say it doesn't happen here. Some of that can be due to the false narrative and the myth. Some of that can be due to simply a desire to believe that this community we live in would never have things like this happening. Unfortunately, it's happening everywhere. Cultivating relationships between agencies is really important. Breaking down silos between agencies and organizations that don't typically work together or may not historically work well together is really huge. I think one of the worst things we can do for victims is to allow politics or poor working relationships to make our response less effective. Another thing we learned is that political pressure can get results. So there was one particular county in Minnesota that was really concerned with the law enforcement response in their area. They were not getting a lot of buy-in, in particular from the sheriff's department. So what they did was set up individual meetings with the folks who were running for the position of sheriff, which happens to be up for election this year. So the site coordinator of this team met with the candidates and really talked about the importance of exploitation and trafficking protocols for their area, and really made sure that the community who was involved and interested in this issue really went out and said so and advocated for that with their candidates. It's been working really well for them. It turns out the sheriff was all for it and just wanted to know exactly what it is that they needed to do. So we've had great response from the sheriff's department in that community. Political pressure can get you a lot of places. Another thing is that incremental change is still change. When we're talking about protocols for things like trafficking and exploitation, a lot of times these protocols don't exist yet. And to do it effectively, we need to change systems, which is a big process. It's messy, it's long, and there's usually a lot of resistance. So we have to take the small wins. Any change counts. Any additional community awareness, any additional processes or trainings that occur, the more people know, the better. You take the small wins where you can get them. It's the process, and you got to start small. The next part is start with what you have. You can have a great response regardless of what resources you have available. Start with what's there and figure out how to make it work better. A lot of times, rural communities have a lot of great advantages, including personal relationships. People know each other, and that may seem in certain situations like a bad thing, but it also means that people are able to see what's going on with their neighbors. You have a huge opportunity to identify and respond to situations before they get out of control. Starting with what you have, a lot of you on this call are involved in sexual assault response teams. That is a huge place to start. A lot of the key responders that you're going to need for exploitation and trafficking protocols are already at that table. All right, so next steps. First thing is community awareness. The keys to this are dispelling those myths and false narratives and making sure that people understand the realities of what exploitation and trafficking look like in all communities. Engaging with youth and families. So that could come in the form of community forums, school board meetings, local bulletins, and other existing platforms. Making sure that people are aware of the risks and the realities is the first and most important step. My favorite is protocol development. Start with your start. You've already got these people at the table. You may need to add a few. You've already got an awareness of sexual violence in your community and an awareness that there are certain systems that need to work together to help these victim survivors. That's the key to all of this. Evaluate what you have. Figure out what's available, how does it work, how can we make it work together. Engage and inform community members and also service providers. There are a number of service providers in various disciplines that might not be terribly aware of trafficking or aware of what their particular discipline can do about it. And building relationships is key. It's important that people really work together. In these teams, there is a lot of tension. There's usually a lot of systems that need to work together better that have not historically worked together well. Building those relationships is the best way to break down those silos and figure out what to do that will be the most helpful for the victim survivors. And that's it. So, does anybody have any questions?
We have a number of questions as we encourage folks, and we really wanted with this particular webinar to save a lot of time for questions, because one of the things that is challenging and exciting about providing technical assistance and support to rural communities is you all have vastly different conditions of what that rural community needs. So we really wanted to spend time on the question and answer portion to really get to all of the differences, because we want to address what is unique about your community and what you really want to know about how we provide better services. So I'm going to start asking some of the questions that have already come in.
Okay.
For those of you listening, if you have questions, please put them out there either in the question and answer portion or in the chat. So with that, let's get started. I'll put them mostly in chronological order for you. So if youth and or folks do not identify with the term victim, what does resonate with people? How do you talk to them? Especially if they don't, like, victim doesn't work for them.
Yeah, that's a good question. A lot of times, the best thing you can do is ask that young person how they identify themselves. They can usually tell you what they would prefer you call them. Typically, when we're talking about these young people, victim survivors is a very popular way of speaking about it. We can also call them the youth involved. We can call them sexually exploited youth. But when we're talking to the youth themselves, it's always best to find out what they prefer.
It's a great question, or a great response. Thank you. The next question that's tied very closely is particularly thinking about even your own experience working with sexually exploited youth, but then also in working with these rural-specific protocol teams. How do we start the conversations when they don't see themselves as in danger, or other rural service providers don't identify them as victims or see these youth as in danger?
Yeah, so I mean, it's difficult. There is a tendency that people have to not want to identify with issues like this. So when you're talking with them, really show them the realities. There is research available, and there are lots of resources, including this webinar, that are out there that can really help people understand what exploitation and trafficking actually looks like and how it occurs in their communities. I think sometimes having that conversation ends up being a little bit of a tough love situation. You know, I don't want to scare you, but your child is at risk. Do you have the internet in your house? Your child is at risk.
Excellent. Okay, we still have a bunch of questions to catch up on. So, here's a very connected one. So if someone suspects exploitation when working with a rural youth, what should be the first response in taking action?
All right, so this is going to be dependent not only on your community, but on the situation itself. Part of what's difficult about this work is that every young person is going to present differently and respond differently, and they may have different needs. depending on your role with that young person, it may or may not be appropriate for you to speak directly with them. If you have concerns about trafficking, there's a good chance that child protection will need to be notified. In terms of exploitation, building awareness and being a resource that's available, presenting yourself as someone that they can come to, that they can trust, that will listen to them and speak honestly with them is really important. For folks with mandated reporter status, disclosing that immediately is really important. Making sure that you're building that trust in that relationship. Young people don't disclose immediately. Prior to my time at Mincasa, I managed a program for youth that were involved in exploitation and trafficking. And quite often they were placed there still claiming that they had not been exploited or trafficked. And it wasn't until a month, 2 months, 6 months later that they would be willing to come out and actually speak about their experiences. And that all comes from building trust with service providers.
So another question. So this is clearly someone from Minnesota because they mentioned a local TV station.
Nice.
I read an article online by KARE 11, local Minnesota news.
Yes.
That indicated that judges are not imposing fines upon conviction. Can you speak to that?
I can't speak much to that other than that I have also read that article and seen the news clips. I think that the judicial system in a lot of ways is still learning, just like the rest of us, what exploitation and trafficking look like, what it actually means, and then what the best practices are for responding to that. In Minnesota, there is a requirement that portions of fines given to traffickers and buyers go to different divisions of state and local government in order to provide education and training and services. So for those of you outside of Minnesota, that's a little bit of context. It seems as though a lot of times these fines are being waived, and there may or may not be reasons for that we're unaware of. There's also questions about where those fines are being allocated and if it's being done correctly. That's an ongoing question. I don't have a ton of knowledge about how these systems work.
So this was an easy question that I can tackle. Will this presentation be available to us after the conclusion of the webinar? And they noted it is so good. So thank you very much. Yes, this webinar is being recorded and closed captioned, and we will send out all the materials afterwards. So you can share this information with whoever, wherever, and however many times you wish to share it. This person asked, do you have materials that could be used with community and youth groups?
We have a lot of materials in terms of protocol development, and all of those would be available on the Mincasa website or by emailing me. In terms of curriculums to do education and prevention and awareness building, there are a variety of curriculums out there, and different states use different things. And I can, if you want to email me, I can point you in the direction of some of those. But yeah, there's a ton of stuff out there. Some of it's really great and some of it's less great.
Okay, we're gonna keep trucking. We have so many questions. Keep them coming. These are great. Because again, we recognize there's so many different types of rural, and we didn't want to pigeonhole any one particular. So this question is, how often do you see survivors that have been victims of satanic ritual abuse?
That is a good question. I personally have not encountered this. I cannot speak for other service providers. I think that's an issue that's definitely real. As much as we'd like to think it's one of those myths that people just make up and scare children with. I don't have a ton of knowledge about that. We haven't had a lot of experience with that in Minnesota, but I am aware of it happening in other parts of the country.
Excellent, thank you. And again, just to clarify for folks, the SRA stands for Satanic Ritual Abuse. As a national TA provider, I've worked with a number of states who have indicated that they have a lot of experience with satanic ritual abuse. The one that keeps coming to mind, because it was the most recent conversation I had, was specifically in Utah.
This is the most recent conversation I had as well.
Oh, that's actually a really funny coincidence. So there are other folks out there working on satanic ritual abuse, particularly in connection to youth. And so we can always find if there's resources out there. I'm got to be certain that there are.
There absolutely are, and we can help connect you with folks who are doing that work on the ground.
Ooh, this is a fun myth question. How real is the risk that people talk about on Facebook and other social media where children and young women were being abducted in Walmart and on highways and subjected to sexual exploitation?
Yeah, so I probably should have addressed that considering it's the title of the webinar. But one thing I will say is that yes, there are people abducting children. This is happening. Typically, this is not what a trafficking or exploitation scenario looks like. I'm not saying these things aren't occurring, although they've kind of reached the proportion of the urban legend. If you've seen a van patrolling your neighborhood, there's a very good chance this is just a person who owns a van. There's also a chance that this person is a predator. It's not as real as social media would have you think it is. That said, I don't want to discount it entirely. Things like the van patrolling neighborhoods or people abducting kids out of Walmart are real things that do happen. But I've found a lot of times those Facebook stories are repeated with just the name of the city changed. And those kinds of things are definitely intended to spread fear. I think people, a lot of times in trying to build awareness of an issue, will unfortunately skew people's perception of what that issue actually looks like.
Thanks. And just as a quick reminder, I put in Sarah's email address into the chat box. I mistyped it the first time, so there's a correction one that's right after it. Please choose the second one. In addition, Sarah has a slide with all of her contact information. You can also contact me directly, and I'll get you to Sarah. There are a million ways to get a hold of us for those of you who've asked that question. So back to content-based questions. That was just a little brain break for you.
I like it.
A lot of this was focused on youth trafficking. While much of the information is transferable, do you have any best practices or lessons learned for working with adult survivors?
Oh, so this is a good one. A lot of the reason that we talk less about adult survivors is that in a number of areas, prostitution has not been decriminalized, and what sex trafficking is basically the prostituting of another person. So adults are still being charged with prostitution. Adults are still being criminalized for this behavior in a variety of different areas, which is something I think a lot of us are working on changing, but it's a process. When working with adults, I think really the vast majority of the lessons still apply. The types of service providers are going to change a little bit. The types of services that these people need are going to change a little bit. But aside from that, it's definitely still something we're working on trying to build a response to. A lot of times services aren't available because we have not historically looked at these folks as victims.
A question came in. Do you do any work with CACs, which stands for Child Advocacy Centers, in your area?
Yes, we do. So in Minnesota, we have a number of child advocacy centers that are involved in different ways. The most clear example for me is that we have a network of regional navigators that work throughout the state, providing awareness and case management and coordination of different regions in Minnesota. And one of those navigators is housed in a CAC. This particular CAC provides medical response, so they do forensic exams and forensic interviews. Different CACs have different types of involvement again, and that can be, I think, a really important resource. One of the things that we found is that typically CACs are more effective with younger youth, just based on how systems work. Older youth that are involved may respond better to different services.
Okay, so I'm going to read this question. I want to make sure that I understand it. So, Stephen, if you're listening, what would be the best tool to utilize for a male prosecutor or advocate to transition a victim survivor to a participant in their specific case, given the inherent obstacles? I don't know that if I read that correctly. So I think what's being asked is, how do we best provide tools and resources, especially as a male prosecutor, as a male advocate, when there's all these given obstacles that are inherent in being particularly maybe a male identifying person who does this work?
Yeah, so first thing to be aware of is that when we're talking about youth who've been exploited and trafficked, we're not just talking about girls and women. We are talking about boys and men as well. They are often underrepresented because they report far less frequently. There's often less services available, but boys and men are absolutely at risk. One of the things that I think all service providers can keep in mind is giving their victim survivor a voice in who is serving them. If you know, ask the young person, are you comfortable with me, or would you prefer to be speaking to a female, if that's possible? Using advocates in this role can be really helpful, just to bridge that gap. It can be really difficult, I think, working with girls in particular who've been exploited or trafficked, because often they were exploited and trafficked by men. So I think just being open to the fact that you might not be the best person for them, regardless of how well intentioned you are and how well educated you are, just being open to handing that off to someone that would be more appropriate for that person.
To add a little bit, this is a question I often get about rural service providers, just generally speaking. And one of the things is a lot of rural communities and service providers say, well, there isn't someone to really hand off to.
True.
So one of the things that I provide coaching on, I'm certain, Sarah, you've already done this, but just to build, is that you start giving victim survivors and youth and just whoever you're working with, you give them as many options as you humanly can.
Exactly.
Things as basic as, like, where would you like me to sit in the room?
Mm-hmm.
What would be necessary for you to be comfortable? Do you need a table between? Like, you just ask some of the most basic stuff that we often can take for granted. Even in doing direct service work, sometimes you just take that stuff for granted. Give them back every scrap of power and decision-making that you can humanly muster, if there isn't an alternative to provide somebody else that they would feel more comfortable with, because that's the reality of rural service provision.
Yep, and to add to that, even so, say you are the male prosecutor and you are the only person available. If there's someone that they feel comfortable with, let them be in the room. If there is an advocate or another service provider that they have developed a rapport with, allow that person to be involved, or have that person help do a soft handoff, because that relationship building is going to be really key. Developing trust is hard. I think John Anna made an excellent point when you provide as many opportunities for this victim to be empowered and to make those decisions for themselves. That's where you're really going to build that trust. Once they realize that you really mean it when you say, if you don't want to, you don't have to. I think that can be really key.
Thanks, Sarah. Recently, so another question. Recently, the communities I work in, primarily rural, I find it difficult to work with other systems of notifying of tracking, trafficking and or sexual exploitation and assault. How might I help build bridges and bring more awareness? And this is specific for rural communities.
For systems in rural communities?
Yes, and other service providers.
Yeah, so this is where diplomacy and politics kind of come into things. I think a lot of times there are folks who have traditionally adversarial relationships or for whatever reason might not be as well informed about an issue. And I think it's going to be specific to the situation, but building on relationships that do exist, building on any sort of common mutual understanding. One of the things that I've found is that almost all service providers in any discipline are able to work better together if we are constantly reframing that we are here for these victim survivors, we are here for this young person, and they are what matters.
Yeah, absolutely. Another thing that I can think about, particularly in the bridge building business, and this is having grown up rural and lived rural and have worked rural for most of my life, like we have to let go of the long-standing decades, like somebody somewhere did something to that with that other service provider. They haven't even worked at the organization for 20 years, but we still carry the grudge forward of like, no, we don't work with that advocacy group. We don't work with that medical provider. We don't work with those people because of this thing that happened 25 years ago.
Yep.
I think that's a huge part of rural community and rural life is you do know most people and you know the business most of the time. And it's really on us, like Sarah was saying, to reframe that why we're there and to really try to extend the olive branches wherever possible. So I think that's a key way to help build some bridges.
Yeah, I have definitely worked in organizations where two agencies historically don't get along, and to the point where it's been going on so long, no one remembers why. The people that were originally involved in whatever dispute no longer work there, and yet the animosity continues. This is the part where we have to be the grown-up in the room, and we have to be the bigger person and say, you know, I get that we don't always agree. There are obviously going to be tension points and things that we disagree on, but we really need to remember who we're serving.
Another question, is there a way to share the protocol drafts people are currently working on so those in a development phase can use examples to strengthen their own protocol? Not everything will relate to all areas, but samples would be extremely helpful even in draft form.
So the teams that are currently working on protocols are all kind of in different phases of that project, and I can speak with them about their openness to sharing those. But I do know that we can share our protocol guidelines with anyone and everyone who wants them. So I can look into that and find out if the pilot teams are open to sharing those. Yeah.
So next question, given that it might take 6 months for the victim to disclose, any ideas about how to best manage the prosecution cycle?
Yeah, so this is where it gets complicated. If we're talking about prosecution of the youth, the victim, for some sort of other related crime, that can be really difficult. And there's not much you can do to predict the future. A lot of states are working on things like vacator laws and expungements so that once a person is identified as a victim of trafficking, previous charges can be either dismissed or erased from their records. There's a variety of different levels that people are doing this at, but that's definitely, I think, a good long-term strategy.
Next question, ideas for teaching the judicial system?
That is an excellent question, and I do not have a ton of ideas. I do know that there are resources here at MNCASA that I can provide for people. We have done some judicial training. However, that was all before my time here. So a huge piece of it really is getting the buy-in at the state level. That's going to be the best place to start. And then just really reinforcing, here are the laws we have on the books and here are what the options are, and really informing folks in the judicial system about the real impacts on these victims.
I know, and I know it was a little bit before your time, but not before my time. One of the key points that we really learned through doing some trainings with the judicial folks is the importance that and the centrality is neutrality for them, where if we were to go in and speak from a true advocacy perspective and lobby hard for what we know is right for our victim survivors and for victims across the state, then they couldn't necessarily entertain that information. So it had to be presented, and it has to be presented in a more impartial way of, here are the best practices, here are the research, here are trends we see, and here's what the law holds us to. So we did a lot of crafting to make sure that we were meeting the needs of the judicial folks, so we could even get on the docket to talk with them, because they desperately wanted the education and they wanted the information, but they do have a lot of requirements on them about impartiality. So that was something that my former colleagues worked through quite intensely, and they did an excellent job.
Absolutely.
So those are some ideas.
Emphasis on the laws, on what's currently precedent. Those things are the things to focus on. Judges are not potential funders or donors or concerned community members. And so, the framing definitely needs to be a lot more about what rules exist, how exploitation and trafficking fit into those existing statutes, and then also what their options are. A lot of times, I think, as hard as they try, laws and statutes change all the time. It's hard to keep up. So even just creating some awareness on what the particular responses can be helpful.
Okay, so another question. So since Minnesota has safe harbor law that indicates that there should be emergency housing provided when a victim leaves, quote, the life, why is there not appropriate funding from the state to provide such services? Currently in rural Minnesota, an individual gets a 24 to 48-hour stay at a motel. This does not seem realistic in a traumatized youth to get a different direction in life and decide what direction they're going to go.
Right. So in Minnesota, we definitely have some funding for emergency housing and placements, but not enough. There's never enough, and they are dispersed throughout the state, so you might be several hours away from the nearest emergency shelter. A big part of the problem is determining the best use of funding. There's always limited money available, and finding whether emergency shelter services are the most effective way to use that funding, and then where those services should be located, based on need and based on sustainability, et cetera, are all really complicated questions. I know that the state has been looking at these issues. I don't know where we're at with them, but I will fully agree with you, we don't have enough, especially in rural communities, especially in, I want to say, I don't even want to specify which parts of Minnesota because we have problems all over, but people are working on it. If you feel like your region would really benefit from having some sort of shelter or program, speak with local organizations and see what's available, see what people's capacity is for such things. And then talk to your legislators. We can always use more funding.
Okay, so it is a set of two questions. So from the same person, does Minnesota's safe harbor law protect adults or only youth?
All right, so at the moment, our safe harbor law provides immunity from prosecution only to youth under 18. However, we do provide support and services to adults up to age 24. Minnesota is currently going through a strategic planning process, kind of looking at this issue and determining whether and what kinds of expansions might be possible for our area. But that's where we stand right now.
So the follow-up question that you just answered, but just so you know that we caught it, was they see that they only protect persons age 24 and under, so others are out of luck and seen as criminals, correct?
Technically, yes. That said, different counties and jurisdictions have been responding in different manners. There are county attorneys throughout the state that have sort of tacitly stated, we will not be prosecuting folks for prostitution anymore. So that can be something that is really important to talk about with your local county attorney as, you know, how do we see this issue in our area? Is this something that we want to continue to criminalize? Or is this something that we want to use our discretion to say, nope, we're not going to prosecute these people?
Build those bridges.
Yep.
Okay, so our last question, if anyone doesn't have any more, oh no, just kidding, we had two more questions.
Okay.
One more question from this section and then one last final one. Okay, so what are some strategies for working with survivors in rural areas where often privacy is compromised by the closeness of the community?
Yeah, this can be really hard. And it really depends on what you have available and what your capacity is. I think the first thing that you can do is really make sure that all of your service providers and folks in these disciplines are aware of and adhering to data privacy. When we're talking about minors, there are so many rules that cover what we can and cannot talk about and who we can and cannot talk about it with. I think that's huge, and making sure that you yourself are respecting that confidentiality can be a big piece of it. I think there's an opportunity in rural areas that isn't always there. In more heavily populated places, there is a little bit more of an opportunity for that relationship development piece, which you can really use to your advantage. That's going to be the key when you're working with these victim survivors in any capacity, is relationships and trust. If you're in a situation where there is already an existing lack of trust or some sort of conflict, I think it's really important, again, to talk to that victim survivor and find out what they want to do, and really abide by their choices. We need to remember that to be victim-centered, we need to focus on what they consider to be justice and what they consider to be a successful outcome, not necessarily what we consider to be justice.
Yeah, absolutely. And also, so this is a question I get a lot again, so just to reiterate and give some more ideas, bank on your local connections.
Yep.
Do you have a great connection with the coffee shop owner where there's a private meeting room because the victim survivor doesn't feel safe coming to your organization? Go meet them in that coffee room. Go meet them at the local library in a private meeting. There's a lot of ways that we can get creative as rural service providers on protecting confidentiality. And I know, of course, ideally folks will come to our location, et cetera, but so often that is a big red flag of like, hello, I'm receiving services from the only rape crisis center for the next 300 square miles. Like, I'm a victim. Use your local and community connections, because so often we're part of those communities. So use those in creative ways to find out the strategies you can to preserve confidentiality wherever you can and to uphold dignity and privacy wherever you can.
Absolutely.
Okay, so I'm just double checking for any last minute questions aside from the final. I don't see any. So the only question left is, what can rural service providers do to provide victim-centered care?
So it's it really is about choice. And that doesn't mean choice of providers. That means choice in what services the youth wants to receive and how they want to receive those services. It really also speaks to a lot of what we were just talking about in terms of privacy and what John Anna mentioned. The most important thing you can do for these young victim survivors is to meet them where they're at. And that can mean emotionally, but it can also mean literally meet them where they're at. Go to a place that they feel comfortable. Allow them the control of the situation, allow them the autonomy and agency to be in charge of their own situation.
All right, everyone, this brings us to our conclusion. I don't see any outstanding questions. I didn't see any added in the final minutes. So if you do have burning questions that you are yet needing an answer for, you can absolutely go get a hold of Sarah Florman at sflorman@mincasa.org, or you can direct dial her. Similarly, if you have anything that you think I can answer, and if I can't answer, I'm probably going to send it to Sarah, because while I do have some knowledge of safe harbor and trafficking, Sarah really is our in-house expert. You can always get a hold of me. I also keep the weekly Rural Start blog. For those of you who are dedicated readers, the month of October had no posts for a long variety of reasons. Look for new and upcoming content starting this week. So get a hold of us. Again, I go to Sarah for so many things related to trafficking and sexual exploitation. She is a wealth of knowledge, and we were real lucky to capture her for this webinar. So Sarah, thank you again.
Thank you. It's great.
With that, everyone, we will be ending the webinar a little bit early. Please enjoy your extra 10, 12 minutes of life. And again, reach out to us. We're here, and we're excited to help you with whatever questions may come up in your rural, SART, and general service providing life. Thank you, everyone.